11 signs of high blood sugar levels. Blood sugar levels in people without type 1 or type 2 diabetes typically vary from 70 to 130 milligrams. Fasting hyperglycemia is a phenomenon that has been observed in essentially all individuals with diabetes and may be due to dysregulation of hormonal patterns resulting in increased hepatic glucose output. Blood sugar levels naturally rise and fall, but when they do so regularly, they can cause issues that may compromise a person's quality of life. Hi guys, welcome back to our channel. Today we will be discussing 11 signs of high blood sugar levels. Before we get to it, be sure to like this video, subscribe to our channel, and turn on notifications so you don't miss out on new content. With that being said, let's get to today's video. 1. Increased risk of cardiovascular events. High blood sugar is one of the many risk factors that might result in cardiovascular issues. Preliminary research indicates that hyperglycemia is a significant prognostic factor in acute heart failure, although there is still a paucity of evidence on the topic. Blood arteries and the nerves that control your heart might be harmed by high blood sugar. Additionally, diabetic patients are more likely to have additional heart disease risk factors. Blood flows through your arteries with more pressure when you have high blood pressure, which can harm the arterial walls. 2. Microvascular damage. High blood sugar frequently harms small blood vessels, which is known as microvascular injury. There is proof that acute hyperglycemia damages the microvascular system and impairs functional recovery, particularly in people who have had a myocardial infarction. Diabetic neuropathy results from nerve injury and interference with signal transmission caused by high blood sugar. Damage of this nature frequently impacts a patient's eyes, kidneys, toes, and other bodily parts. 3. Slow wound healing. Injury is nothing uncommon. When wounds heal very rapidly, it can be a sign of high blood sugar. With hyperglycemia, however, such is not the case. People with high blood sugar may have trouble mending wounds, which means that the procedure is often sluggish. This occurs because elevated blood sugar levels stiffen and rigidize cell walls, which reduces the blood flow in the tiny arteries. For wounds to heal correctly, there must be enough blood flow. 4. Fatigue. Fatigue is a prevalent symptom. The body cells have a tougher time utilizing glucose when they have insulin resistance. Blood glucose levels increase as a result. The glucose in the blood cannot be efficiently taken by the cells and converted into energy. The outcome is exhaustion and a sense of powerlessness. Energy will also start to run low. Reduced glucose to energy conversion is to blame for this. 5. Frequent urination. An increase in urine frequency is another sign. The kidneys are under pressure as blood glucose levels begin to rise. The kidney's primary goal is to remove excess glucose from the bloodstream. The kidneys may not be able to adequately control the patient's blood sugar levels if there is a high level of glucose in the blood. These organs will then work to eliminate the extra glucose. Urination increases as a result of this impact. 6. Blurred vision. Damage to the blood vessels in the light-sensitive tissue at the back of the eye, known as the retina, can lead to bleeding in the eye, blurred vision, and complete loss of vision. The lenses of the eyes may swell as a result of elevated blood sugar levels. When fluid escapes into the eye, edema results. Even the lens's shape can be altered for some patients. When this occurs, vision may become hazy or blurry. 7. Nausea or vomiting. Malignant hypertension is a dangerous form of very high blood pressure. Symptoms of this condition may include severe headache, nausea, and vomiting. Additionally, this may also occur as a side effect of medication interactions of drugs prescribed for high blood sugar. 8. Recurrent infections. People with excessive blood sugar levels are also more likely to develop vaginal yeast infections. Candida albicans can flourish in an environment with high blood sugar levels, and infection with yeast can result from this. It can also lead to genital soreness, pain, itching, and other symptoms. 9. Dental issues. Saliva naturally contains glucose. The patient's saliva has too much glucose when they have high blood sugar. Bacterial overgrowth results from this. Redness and gum irritation are common symptoms, and an infection in the mouth can spread, causing ulcers, tooth loss, and other problems. 10. Tingling hands and feet. People who have high blood sugar frequently suffer from nerve damage. Both the hands and the feet may begin to tingle as a result. These extremities can occasionally experience pain as well. However, certain medications can also cause tingling in the hands and feet. Other potential causes of peripheral neuropathy include autoimmune diseases, toxins, alcoholism, and infections. 11. Diabetic hyperglycemic hyperosmolar syndrome. HHS, also known as a diabetic hyperglycemic hyperosmolar syndrome, is a complication of type 2 diabetes brought on by early high blood sugar levels. Type 1 diabetics encounter a different condition called diabetic ketoacidosis, where blood sugar levels are extremely high. Thus, it doesn't happen to them. If left untreated, HHS can lead to heart failure. And it's a wrap, guys. We have come to the end of today's video. If you think we left out any symptoms of high blood sugar, be sure to share them with us in the comment section. Do endeavor to like this video and subscribe to the channel. See you next time. Bye for now.